Top stories on Sky News this afternoon. A family court rules 13-month-old Poppy Worthington was sexually abused by her father shortly before her sudden death in 2012. An independent inquiry finds police missed 3 significant opportunities to prosecute the late Lord Janet for sexual abuse. And a 48-hour strike by junior doctors due to take place next week is called off. Well, more on that now. I'm joined by Reena Aggarwal, who's a junior doctor, joins us live from central London. Very good afternoon to you. So that's good news. The strike for next week has been called off, but a deal hasn't been reached, or has it?
As far as we are aware, a deal hasn't been reached, but I would echo your sentiments. I think it is very good news that we have called off the strike for next week. I think it shows that there has been movement, the intervention of ACAS and also the appointment of Sir David Dalton on behalf of the Department of Health and Jeremy Hunt to negotiate with the BMA. And the statement that the BMA has actually said is that there has been some movement regarding the negotiations, and therefore I think it is only right that we have cancelled or postponed the strike for now, because that would make sense.
Do you know in which areas there have been movement?
I think it's very, at the moment, I don't think we have much information regarding what detail has been negotiated and what exactly has been negotiated. But I have faith in the BMA that if they believe that the negotiations are going well, I think that this is the right decision. I think it's the right decision because we give hospitals a week's notice, so we don't cancel routine procedures, we don't cancel outpatient appointments, and therefore patients will proceed and have their care as every health professional should do. So I think it is the right decision.
Yeah, a lot of patients were seriously let down last week, weren't they? 3,000 operations cancelled across the country. Was it worth it?
It was very regrettable that we were compelled to take strike action, and I don't think any junior doctor, no health professional wished to take strike action. It was always with a very heavy heart. I myself actually didn't strike because I was providing emergency cover on my labour ward. But yes, it was very regrettable that about 3,000 patients had their procedures or their outpatient appointments cancelled. And of course, within the NHS, we are working to make sure that those patients do have those appointments rebooked. But yes, I think that the fact that we have got ACAS back into the negotiations, I think the fact that Sir David Dalton is now part of the negotiations, the fact that we have now cancelled or postponed the next strike would say that actually our actions have been shown to be the appropriate ones.
Sure, unfortunately, it's patients, people who have nothing to do with the strike, who are being held hostage here, aren't they? People who've, in many cases, waited months, I imagine, for their operations and may now have to wait many more months for those to be rescheduled. The strike's been called off for next week, but there's still a further one planned for February, in which a number, hundreds more people may have their lives affected by what you and your colleagues are doing. You said you didn't strike actually last week because you were covering for emergency care, but you may be involved in future strikes. And do you think that's just a price worth paying?
I think that it is. I don't think the junior doctors are holding patients to hostage. There are doctors within the hospital, and if there is a strike that is held on the 10th of February, there will be senior clinicians, the consultants, who will be within the hospital. What my fervent hope would be from the negotiations going toward the 10th of February, which I think is about 3.5 weeks away, is that we do actually achieve a resolution, that we do actually get a contract that satisfies the junior doctor population as well as manages to satisfy the Department of Health. So I would be very, very hopeful that we don't need to have a strike on the 10th of February. And I think we need to wait and see how the negotiations proceed. I think it's a positive step today. I think the BMA have done the right thing. I think obviously the negotiations are obviously going better than they had been previously. We need to wait and see what the detail of the negotiation and what the detail of the contract will be.
Obviously, you're not involved in the negotiations yourself, but it's something that you feel very strongly about. It will affect your life. What are the key areas that you are willing to move on? I think the things that junior doctors are most concerned about and would like to ensure is that there are appropriate safeguards in place to ensure that when we work
there is a robust mechanism to ensure that doctors are not overworked and they don't work excessive hours. Currently, there are financial penalties that are placed on trusts. We need to ensure that whatever mechanism is put into place, this is robust, it's independent and effective. Secondly, I think there is still quite a lot of tension between the Department of Health and the junior doctor population regarding weekend working and the rhetoric that is constantly being peddled in the news and by government ministers about this excess weekend mortality. I think that we need to ensure that the policies that we're instituting are evidence-based policy rather than policy-based evidence. The data that is being represented, for example, the recent data that the Secretary of State for Health and David Cameron this morning was discussing on Radio 4 about there being an increase of 20% deaths on the weekend from stroke. That's plainly incorrect. That is old data. That is data that was represented before we had acute stroke units. Actually, the data shows that people with milder strokes probably delay their presentation to hospital, and what that actually means is that people with more severe strokes are potentially being admitted on the weekend. And unfortunately, as we all know, if you're more unwell, potentially there's more of a chance that you may die, unfortunately. I think we need to just clarify what we mean by 7-day services. I worked 7 days this week gone. I worked on the weekend. There was no lack of junior doctors, there was no lack of senior clinical decision makers. However, the things that we do lack on the weekends include diagnostic services, lack of community services, and actually lack of other staff. On my ward, when I went along with my consultant and with my other junior doctor, one of the issues that we talked about was the lack of nurses on the staff, and one of my colleagues, a nursing colleague, said, yeah, this is actually very common. So I think we need to address the broader picture regarding 7-day services. Junior doctors are not the barrier to change. If the evidence pointed to the fact that actually increasing the number of junior doctors upon the weekend would make a difference, there would be no argument. The data and the evidence does not necessarily say that. Dr. Fiona Godley, who's the editor of the BMJ, recently published a letter, an article in the BMJ this week, and she says 7-day services, perhaps there is an increased weekend mortality. We're not 100% sure of what the causes are, but part of the causes could be a lack of senior clinical decision making, a lack of diagnostic services, a lack of community services, and perhaps a lack of staff. But when we mean a lack of staff, we mean the nurses, the physiotherapists, the occupational therapists. You have exactly the same number of junior doctors during the week as you do on the weekend providing your emergency service. There is no change regarding that. Yes, we don't have routine work, we don't have knee operations, we don't have cataract operations on Saturdays and Sundays, so therefore we do have less numbers of doctors who would be providing that care during the week. If we want to actually have a serious conversation about what we mean about 7-day services, let's have that, let's engage with the clinicians, but actually potentially saying the junior doctors are the barrier to implementing the manifesto by the Conservative government for 7-day services is plainly incorrect, and it's actually unhelpful. It is causing a great deal of frustration for the medical community and potentially causing harm for patients. Recent data...
Okay, sorry, we must leave it there, but thank you very much for your thoughts this afternoon, and we'll wait to see what happens with those negotiations. Reena Aggarwal, thank you.